All right. We seem to be appearing live, so welcome. If this is a bit glitchy, I apologize, but we are, of course, like we all have been going for the last few months with some tech issues and some live issues, but I'm glad we're able to connect. So hello and good evening, everyone. Thank you for joining the Canadian Liver Foundation today for our Facebook Live educational event on fatty liver disease. My name is Nem Maximovich. I am the Manager of National Health Promotion and Education for the Canadian Liver Foundation. I will be the moderator for this live educational event. We are joined tonight by our presenters. We have Dr. Mark Swain from the University of Calgary and Dr. Diana Major from the University of Alberta. Dr. Swain is a liver specialist and professor in the Department of Medicine at the University of Calgary. He is also the head of Division of Gastroenterology and Hepatology, also at the University of Calgary, and is on the steering committee of the Canadian NASH network. Dr. Diana Major is an associate professor in clinical nutrition at the Department of Agricultural, Food and Nutrition Science at the University of Alberta. Her research focuses on treatment strategies, including nutrition and lifestyle modifications, and chronic liver disease in both children and adults. Dr. Major is also the chairperson for the Canadian Liver Foundation's National Education Advisory Committee. Now, before we begin, here's a quick overview of tonight's schedule. We will have each expert speak before moving to a live question and answer portion. Please feel free to use the Facebook Live comment feed below to ask your questions. Okay, now this presentation will be available on our Facebook page following this event, and it will also be available on our website and YouTube page in the coming days. Now, to begin, just quickly, for those of you who may not be familiar with the Canadian Liver Foundation, I'd like to provide you with a brief overview of who we are and what we do. The CLF was established in 1969, actually just recently celebrated our 50th anniversary, and we were the first organization in the world created to help people with liver disease. We are committed to promoting liver health and improving the prevention, diagnosis, and treatment of liver disease through our 4 core pillars: education, research, patient support, and advocacy. Now, tomorrow, June 12th, is International NASH Day. Held annually, this day is dedicated to increasing awareness about non-alcoholic steatohepatitis, or NASH, the more severe form of non-alcoholic fatty liver disease. This awareness is aimed amongst various populations, some the general public, patients and caregivers, the medical community, public health authorities, and the media. Now, without further ado, I will pass it on to Dr. Swain to talk about his portion of this presentation, which will be what is fatty liver disease.
Thanks, Nam, and hello, everyone. I'm going to talk to a little bit about fatty liver and sort of give you some background of what fatty liver is and why, as a liver foundation, we're worried about it, and some patients we're not worried about it. So this picture shows on the top, that's a normal liver, and I think if anyone's been to a supermarket or cooked liver, you know it sort of has a pink outer sort of appearance, and essentially what it is, it's full of tiny microscopic cells which are like balloons, and those balloons have that sort of pinky color that's on the right hand side that's sort of supposed to be a magnification. And what happens in fatty liver disease is that the cells become full of fat. So the balloons expand and they become full of fat, and we all know kind of what fat looks like. It's sort of a yellowy color. So the liver takes on this yellow appearance, and when you look at it under a microscope or cut into the liver and look at it microscopically, you see these sort of yellow or whitish areas where the fat was, and those are actually cells that have expanded and they're full of fat. And in most people, fat in the liver is really quite benign. Actually, it doesn't cause disease of the liver. Next slide, please. So what causes non-alcoholic fatty liver disease, or NAFLD is the short form for that? Well, there's a number of different causes. Sometimes there are some genes that some people have that predispose them to getting fatty liver. Sometimes people will take medications like amiodarone or tamoxifen or methotrexate. Those can cause fatty liver. But the most common causes of fatty liver disease are really obesity, and it's really a BMI, or a body mass index, above 30. So healthy is kind of about 25. And diabetes, or impaired glucose tolerance. So maybe not quite in the range of being when a family doctor might call you someone a diabetic, but they're not responding to insulin quite like they should. So they're resistant to the effects of insulin. So the blood sugars go a little bit too high. And then the third one is fats in the liver, like cholesterol and triglycerides are the two main fats. And those can also predispose to fatty liver disease. But really, it's obesity and diabetes, which are the main drivers of fatty liver disease. Next slide, please. And so when people talk about non-alcoholic fatty liver disease, or NAFLD, what they're actually referring to is a spectrum of disease. And so when I showed you that first picture, that was really just, that's fat in the liver. And kind of the fancy name that we use for that is steatosis. And so fat in the liver is really just like fat in the arm, or fat around our abdomen, or whatever. If we gain weight, the fat's there. If we lose weight, the fat goes away. And in most people, fatty liver is quite benign. But fatty liver is common. It affects about 25% of the adult population, so it's very common. So for some reason, some people that have fatty liver, their immune system decides it doesn't like the fat in the liver, and we don't really fully understand why that happens. And their immune system then starts to, or decides to, attack those liver cells that have fat in them. And so what it will do is, by attacking those liver cells, it actually will start to kill those liver cells. And this is what we call NASH, or non-alcoholic steatohepatitis. And NASH is actually when the fatty liver is being damaged by the immune response, or our immune system's attacking the liver cells. And so as these liver cells die, the liver is a miraculous organ. Actually, if you cut a liver in half, it just grows back. It's actually the only organ in our body that regenerates. So if the liver can make cells to keep up with the cells that are dying, frankly, it doesn't really care. It could do that your whole life long, and you don't get progressive liver disease. And when I talk about progressive liver disease, what I'm really talking about is scar tissue. And if you look in the top right-hand picture, that blue colored stuff, that's scar tissue in the liver. And so what happens is, if you're killing liver cells at a rate that your liver just can't keep up with, it starts to heal itself by scarring. Just like if you have a small cut on your arm, if you 2 days later you look and you won't even know where it was. But if it was a big cut, the skin can't keep up with that to try to heal it, so it throws scar tissue down to heal it. And you can think of the liver doing the same thing. It can't keep up with the damage, so it throws scar tissue down. And as more and more scar tissue accumulates, like that blue stuff in that top picture, if you get enough scar tissue in the liver, so it starts to surround liver cells and form little round circles of liver cells, or nodules, which you can see kind of in the pink area in that top picture. It's kind of like the blue stuff surrounds those areas of pink. And what that is that's cirrhosis. So that what happens is there's so much scar tissue being thrown around, or down and around, surrounding these pockets of liver cells, that the liver takes on a lumpy, bumpy sort of pattern, and that's really cirrhosis. And that's what we're worried about in NAFLD, because people that progress along with fibrosis and develop cirrhosis, well, of course, they have a risk of developing liver failure, and developing liver cancers and requiring a liver transplant. Next slide. So what are the best, or what are the treatments for fatty liver disease? Well, really, because fatty liver disease broadly is being driven by obesity and diabetes, which are very tightly linked, really its lifestyle is the main cornerstone of approaching fatty liver disease. And so this is really exercise and diet, and Diana's going to talk much more about that, so I'm not going to really address that, but I'm just going to stress the fact that it is the cornerstone of therapy. And obviously, if exercise and eating properly and avoiding the bad foods was easy, we'd all be our perfect weight, and we wouldn't be here talking today. So obviously this is a challenging thing in the world we live in, and so there are a number of things going on in the pharmaceutical world where they're trying to develop medications to treat fatty liver disease. And this is really a huge area. There's probably 200 clinical trials going on worldwide. They're trying to find drugs that can not only stop the ongoing damage in the liver, but actually affect the scarring in the liver and make the scarring get better. And that's really the target. And so people that have developed advanced liver disease, then those individuals can potentially be treated with these drugs and have them reverse that scarring or improve the scarring so they can live a normal life without worrying about their liver having issues. And so what's happening in Canada with regards to research programs approaching NASH? Obviously, the Canadian Liver Foundation has an integral role in I think educating individuals. That's why we're all here today, and I think growing awareness about fatty liver disease. But there's a group of people who are interested in fatty liver disease who have actually formed a group called CANASH. Fitting it's in Canada, it's NASH. And essentially the idea was to really not only expand awareness, but I think really look at research ways that we can approach fatty liver disease and try to develop programs where we can actually try to identify people who have fatty liver disease who are at risk of progression, because most people with fatty liver disease are not going to progress to serious liver scarring. And so we need to find the people that are that have a liver issue and that are at risk of progressing, and then obviously deal with them from a liver point of view. Whereas most people that don't have progressive liver disease, they actually need to be managed more from really a cardiovascular risk point of view, because the most common way that people die with fatty liver disease, of course, is not dying of liver disease. They typically die of cardiovascular disease. But the people that have significant liver scarring are at significantly increased risk of dying from their liver disease. And so we need to find those people and help their livers, essentially. Next slide, please. I just want to touch on this as my last slide, because obviously COVID is in everyone's minds these days. And when people talk about COVID in the liver, really, COVID doesn't, in a broad sense, cause liver disease. It can cause a little bit of inflammation in the liver, and it can cause the liver test to go up a bit. But usually people don't develop such severe liver injury that they actually would die from COVID affecting the liver. It's other organs that are really the problem. However, it's important to recognize that there is a link between non-alcoholic fatty liver disease and COVID-19. And really what it is that people that have what's called the metabolic syndrome, which is high blood pressure, diabetes, and being overweight, those things, high blood pressure, diabetes, and being overweight, increase your risk of getting severe COVID. And if you get COVID, then your risk of actually ending up in the ICU and potentially dying of it is higher in people that have NAFLD. So it's important just to be aware that NAFLD enhances the risk of individuals of potentially having more severe COVID if they happen to be infected. Thanks.
Thank you, Dr. Swain. I'll be moving on to Dr. Diana Major discussing fatty liver disease prevention and lifestyle.
So good afternoon. Thank you for the opportunity. It's afternoon in Alberta. It's really important, as Dr. Swain said, about maintaining healthy body weights. And there is an increased risk for NAFLD with individuals who are obese. But it's obesity and looking at your body composition in terms of maintaining a healthy body composition really is more than just your BMI, because there is a small percentage of adults who develop NAFLD who have body weights within the healthy reference ranges. So their BMI might be 27 or even 24, and they may not be in the obese category. So there's some other things that you need to think about with your body composition. And the first one is your waist circumference. And waist circumference is really important to consider, because it is a good marker or representation of visceral adipose tissue in the body. And it's really this adipose tissue that is responsible for developing inflammatory mediators that hurt your liver, and also that contribute to other components in the pathway of the NAFLD pathway. So for males, for adult males, if you have a waist circumference greater than 102 centimeters or 40 inches, and if you're a female, around the 35-inch mark, that's associated with an increased risk for developing cardiovascular problems, diabetes, and a fatty liver. So when we think of body composition or trying to maintain a healthy body composition, it's important that we think about both our BMI and waist circumference. And then the other thing a lot of people don't think about as well is muscle mass, because there's some evidence that adults with NAFLD, for example, have a lower amount of muscle mass than perhaps their counterparts that don't have NAFLD. And why do we care about muscle mass? Well, muscle mass is really important because it gives you the strength in your joints to be able to do your activities of daily life, climbing stairs, walking and running, just the regular activities of daily life. So muscle mass will also be an important component of trying to maintain a healthy body composition. And in the subsequent slides, I'm going to talk a little bit about lifestyle and the things to think about that will help you do that. Next slide. So one of the strong evidences for a healthy eating pattern is the Mediterranean diet. So you've probably heard about that throughout. You'll see lots of different diets, but the Mediterranean diet is really a diet that focuses on fruits and vegetables, but also the consumption of fish and seafood. And then you'll see on the nice left-hand side of the slide, you'll see a wine, red wine, because red wine has polyphenols, which are antioxidants. So while the Mediterranean food pattern does suggest that all foods can be consumed, the biggest part of the triangle, on the bottom of the triangle, you'll see are pictures of fruits and vegetables. They're full of antioxidants. You'll see the emphasis on olive oil, legumes, nuts, and seeds. The olive oil is a really important component of the diet because it's a very good source of healthier fats that are thought to be good for your liver and also for your heart. Next slide. So specifically, I'm still showing you the picture of the Mediterranean food pyramid because, again, this diet really does, in terms of nuts and seeds, whole grains, and fruits and vegetables, really does provide important sources of a type of fat called monounsaturated fatty acids. Those are really important because they can influence the way fat is shipped around in your body, to your adipose tissue, or in your liver. So those are really important. Omega-3 fatty acids, which are fish oil, which are present in fish like salmon, for example. Those are also really good healthy fats because they affect the way the body responds to increased inflammation and damage. If you eat a lot of fast foods, you're going to produce metabolic endpoints that are full of inflammatory mediators. And so if you eat more omega-3s in this type of fat, that helps combat that. Omega-3s are really good for decreasing the triglycerides in your blood levels. And that's also good for your body to keep your triglycerides in healthy reference ranges. So important. While fat's important, we don't want to eat too much of it, but the types of fats that you might eat in a typical Western diet, or in fast food outlets, that's a saturated fat. That type of fat is the type of fat that gets built up in the liver when you have a fatty liver. So not really the best thing. People ask me all the time as a dietitian, well, is it okay just to eat McDonald's once or twice or 3 times? And I say it is okay to eat those kind of foods sometimes, but I actually studied in kids how the way the body metabolizes and clears the fat from a fast food meal that was kind of like an Egg McMuffin meal versus a breakfast meal that was lower in fat and lower in cholesterol. And we saw a big difference. So like equivalent to like a fish-based meal. And we could see the clearance of the lipid was much better in a fish-based meal than it was with the higher fat, higher cholesterol meals. So it does matter what you eat in the short term, but it also matters in the longer term. So there's lots of evidence that the Mediterranean diet is really healthy for your liver and reduces the amount of fat production, leading to steatosis. The other thing is it's important to consume enough vitamin D. So like we live in North America, sunlight exposure is great in the summer, like the sun's going to set tonight in Edmonton, maybe starting at 9:30 and it's still light till 10. It rises at 4 a.m. Right now, maybe 4:30ish, it starts to rise and it's light outside. But the sunlight exposure in the winter months when we have a sunset, like at 3 o'clock in the afternoon, means that our skins can't make enough vitamin D for our bodies. And so we would rely on our diet to try to meet it. And that can be challenging. So some of the things that focus on terms of teaching or using easy tools to counsel individuals on eating a healthy diet are really important. Next slide. So if you go to the next slide, you'll see that I'm showing you the new Canada's Food Guide. So the new Canada's Food Guide is really more focused not on individual food group, how many that you eat, but rather what does your dinner plate look like? And I mean a regular dinner plate size. So you can see on the left that in this example of the plate, it's full of fruits and vegetables that are green, orange, and yellow. And that is also promoted in a Mediterranean meal pattern. Then you'll see like another, on the other side, half of the plate is grains, whole grains that will give you lots of fiber. And then in the other quarter, that's where what your plate should be in terms of your protein foods. And you'll notice in this Canada's Food Guide, it's a little bit different because they really emphasize plant sources. You can eat meat, but like animal protein you can eat, but the emphasis is now that it's a good idea to eat an equal balance of different types of proteins, both fish, lentils, legumes, because they're excellent sources, nuts and seeds, because they're excellent sources of omega-3 fatty acids and monounsaturated fatty acids, so that this plate represents what your plate should look like every day. And if you look to the plate on the right, this is the American recommendations. The major difference that you'll see about this plate, because it's pretty much the same, is that they've got a glass of milk on the side for dairy, and that's because vitamin D is mostly predominantly present in vitamin D fortified foods like milk. It is naturally occurring in fatty fishes like salmon, for example, which also have the omega-3s. But that's also really important to incorporate into your meal. So if you look on the right, you can see that your foods can be tasty and yummy. You can see the pita bread that's been wrapped with lots of vegetables. There's a little bit of chicken in there. There's some salad on the side. But you can eat all sorts of foods and you can mix them together. But if you follow the basic idea that you think about that half of your plate needs to be made up of fruits and vegetables, you'll go a long way to be able to promoting changes in healthy eating. And it's not that easy just to switch from a diet where maybe you didn't eat a lot of healthy fruits and vegetables all at once. So you have to be don't be hard on yourself. Maybe your first goal for changing the way you might eat will be just to increase the variety first of fruits and vegetables. This is a good time of the year to try because there's a lot more on the market out there with because of the seasonal variations. Choose your favorite vegetables and fruits and choose those first to try to fill up your plate on the left-hand side of your plate. And if you make changes even of if you're usually only eat a quarter of a plate, maybe then you can eat 2/3 of that on that side of the plate and slowly increase on a daily basis. That'll help you feel like you're making change without having to radically changing everything at once. You've got to give yourself a break. And the important thing is to work towards that. You know, it may take you a few weeks to a month to like fill up that half. Then you might work on the other side of the plate. Where you might start to try some other different types of beans and lentils on a couple of days a week. I love chili. My husband loves it. It's Father's Day this weekend, and my husband loves it when I make him chili and to get him to increase his lentil consumptions. I make that heavy on the kidney beans, and that's a way that he can get increased lentils in his diet. Next slide, please. So what about physical activity? Because there's more than one. It's important what you eat and to eat a healthy diet, but it's also important to every day incorporate some physical activity. So I'm not talking about that I want you to go out and if you don't normally run as a part of your routine to all of a sudden start running a 10-kilometer run. It's about trying to increase your physical activity levels. The best way to start is to increase your activities related to your routine activities of daily life. Taking the stairs instead of the escalator or the elevator. Walk outside. This is a great time of the year to like walk outside with your pets. It's a great idea to walk out with your kids and to walk outside. That suits social distancing in the COVID world. But it's also a good idea to move around more in your house if maybe you haven't been able to be outside or do that. So things like house cleaning. My kids don't love it when I tell them, oh, if you clean your room, you're going to get a lot more physical activity. Walk up and down the stairs more in your house. Or if you live in an apartment, maybe you could walk part of the way down or part of the way up, a couple of flights as your first try, and then take the elevator from a different floor up to your floor. But it's important to incorporate physical activity every day and to move around every day walking. Health Canada does recommend 120 to 150 minutes at least 3 times a week in terms of moderate and vigorous, but it doesn't all have to happen in an hour or 2 hours. That can be segmented up, that when you go to work, you're walking up the stairs at work, at lunchtime, you're stepping outside and you're walking around the block. It can be in different segments and components, but that is the general recommendation in order to keep your liver healthy. Don't move to focus on losing weight. Move to focus on increasing the level of activity you have as your first step. You have to be careful about your joints, and if you aren't used to routine physical activity, you don't want to injure yourself. So the other thing I want to point out is flexibility is really important, and balance and stretching activities are also really important to loosening up your muscles and to make the routine regular movement easier for you to perform. Next slide. So the only other thing I did want to mention too was about the COVID world and how to have a healthy lifestyle. A lot of people, like in Edmonton, it was -40 when we went home, and it's challenging to walk your dog or in a -40 weather. Calgary's way easier. Dr. Swain has it much easier in Calgary. He gets Chinooks. Toronto has it much easier. I'm from Toronto originally, and they don't have snow all the time. So what can you do in your house, like to move a little bit more and to increase your activity during those months? And again, household chores, walking more in your house. You can stretch against your wall to stretch your limbs. For muscle strength, you can, even the act of putting dishes into your cupboard can move your elbows up and down. And when it comes to grocery shopping, because we have to follow the rules for social distancing to keep COVID under control, and those are good rules, it's good to prepare a shopping list of what you're interested in buying ahead of time, because if you know what you would like to buy ahead of time and you can put it on your phone or whatever, that'll be helpful for you to know where to look in the store. Looking at when you go to a grocery store, looking online to see if they have any specials, because more and more online grocery shopping is being done. And instead of having those coupons and everything at the store entrance, a lot of, in Edmonton stores, we don't have those anymore. So looking online to see what the special is, so that can be helpful. When we first went into isolation or quarantine, so to speak, working at home in the virtual reality, we sometimes people were buying stuff in bulk. So there weren't some foods that were always available. So checking the Loblaws website to see if they have any specials will help you ahead of time know that you will be able to find the foods you're looking for. Frozen foods are great, like to buy frozen veggies and frozen fruits ahead of time, because if the supply, say, of a fresh particular vegetable is delayed, you will still have a potential to be able to eat those. Those are just as healthy as the fresh kind. And frankly, during the winter months, where the food supply is already impacted by seasonal variations, that can really help you bridge the gap of getting fruits and vegetables, different varieties of those. And I think that's a really important thing to think about, because you still can eat healthy during COVID, but it's important to plan a little bit more ahead of time, so that you can, by looking at the websites of the grocery stores, so that you can see what the specials are and what are the choices that you have open to you. I'm not a big fan. I've never been a big fan of bulk bins, and during the period of COVID, I'm not. There's not too many bulk bin foods available for good reasons. So maybe stick to the more fresh or frozen sources of foods during this period of time. Interestingly, I did notice, just for anyone, for FYI, that some specialty foods were more routinely available in Edmonton, because those weren't foods that people. So what do I mean by that? I see patients with celiac who eat a gluten-free diet, for example, and there were tons of those foods. So there were periods in the last few months where there were some foods that were less routinely available, but in the frozen versions, usually they were available. And so I encourage you to look ahead for those as well. And that will help you sort of flatten that the food insecurity curve, because food insecurity means being able to get access to a healthy food supply without that's affordable and available. And so by looking ahead at what is available on the websites of the major grocery chains, you will be able to get some sense that there are alternatives for you to choose. So I think that's a planning. I used to spontaneously just go into a grocery store, and now I'm more planning on my phone and making conscious decisions of what I'm looking for before I even go. It just makes the grocery shopping experience all that much easier and less stressful to do that. So that's one suggestion I have for you. Next slide, which is basically saying thank you.
I want to thank you both for the great talks. We're moving on now to our live question and answer for the evening. So if you haven't done so already, please do feel free to use the Facebook live feed section at the bottom and ask your questions. We do have a few that have already came in. So I'll ask the first one here to Dr. Swain. Dr. Swain, given that NAFLD and NASH diagnosis is such a new conversation, can you walk us through how it is diagnosed and any advances you see in the fatty liver disease conversations that come up to the forefront?
Sure. Well, the first thing is to recognize, as I've already mentioned, that fatty liver disease is very common. So 25% of adults have fatty liver disease, and really the incidence of fatty liver disease is paralleling the incidence of obesity and diabetes, which are really at epidemic proportions in Canada and across North America. A lot of people say, well, who have fatty liver disease say, well, I don't feel anything. I don't feel any different. I don't feel liver pain or any symptoms. Well, most people with fatty liver disease are asymptomatic. So yeah, in general, the expectation is most liver disease are silent, actually. And the one symptom that people can have is sort of up in the right upper side of the abdomen, is to have some discomfort, which is usually long-lasting and sustained and low grade. So it's not like a knife being jabbed in, although it can be sharp in sometimes. But typically it's this dull aching pain, and that really comes from the capsule that surrounds the liver, which is full of nerves. Now, if that capsule stretches, that's what causes that dull aching pain. And if for some reason there's a pressure on the liver, so say a tight belt or someone pushing there or bouncing maybe in a car or something like that, then often that can make the pain be a bit more sharper, and that can bring people to medical attention. It's also important to recognize that people that have metabolic syndrome, so if you have diabetes or you have high blood pressure, or you have or you're overweight, then you're at increased risk of fatty liver. But usually how it's picked up is usually by family doctors, actually, and typically it's usually identified by people with abnormal liver tests, although half the people have persistently normal liver tests, so that's not a great way to find it, but it is a way to identify it. Or some person might have an ultrasound for some other reason. Maybe they're having abdominal pain, or they're getting this pain up on the right side or whatever, or they're worried that they have gallstones, and they go for an ultrasound of the abdomen, and it shows fatty liver disease. So that's really I guess the broad way on how fatty liver disease is diagnosed. I think the issue is that a lot of people are really not aware that there are this subgroup of people with fatty liver disease that get progressive scarring and then can end up with cirrhosis. And when I see people in the clinic that actually come in and they have cirrhosis, they say, well, I've never felt unwell. I've been healthy my whole life. I may be a little bit overweight, maybe especially around the middle, and my blood sugars have been borderline, but my doctor never felt like they had to be treated because they were just always borderline. And then they said, how can I possibly have cirrhosis? So I think it's very important to have a degree of suspicion, and then there are newer approaches, a lot of them coming through organizations like the Canadian Liver Foundation or CANASH, where we're trying to figure out ways that we can move the diagnosis of significant liver disease in patients with fatty liver disease into primary care. So family doctors can do tests right in their office that give a clue whether or not this is someone I need to worry about their liver, or I don't need to worry about their liver, and I can focus on the other things that go along with metabolic syndrome, like controlling their blood sugar better, controlling their high blood pressure better, and working on ways to try to lose weight, like Anna was chatting about.
Thank you for that. We got a next question here for Dr. Major. Dr. Major, we got an audience question asking, the keto diet calls for a high but healthy fat intake, which seems like it would carry a higher risk for fatty liver disease. Yet, I've read articles that indicate fatty liver is reduced in keto dieters. Can you explain how this could be?
Well, the keto diet is generally speaking a lower carbohydrate diet, so a diet that's lower in sugars and higher in fat. And one of the reasons that it's speculated that diet might be better for fatty liver is the idea that if you have lower sugars in your diet, you won't produce as much fat in the liver because you won't be stimulating as much insulin secretion. The problem with the keto diet, it depends on how low of carbohydrate are you talking about. If you're talking about going down to like 20% carbohydrate, then the fat intake in your diet will be very, very high, like closer to like 50 or 60%. And that's when it starts to get questionable, even if it is healthier fats, whether that's really good for your liver or not, because your calorie intake could go up with a higher fat approach. So if your fat is in that kind of range and your calories do go up, then that isn't a good thing for your liver. Being in energy excess stimulates an upregulation of fat in synthesis in your liver and elsewhere in your body, and that wouldn't be healthy. So it depends on what form of the keto diet, and there's a large range of that. So there are some keto diets, or they frame them, the wording of that as a keto diet, maybe where the carbohydrate's more like a 40% carbohydrate, and so the fat might then just be 30%. And maybe that might be a healthier approach. It's fine so long as you're not gaining weight on that diet, because if you're gaining weight on any diet, you're having too many calories. That's going to upregulate your fat synthesis in any case. So I think a moderate carbohydrate intake, where you would be like at this 40% intake of calories as carbohydrate, might be fine. But it depends on the type of carbohydrate too. So you have to make sure that you're not having a lot of added, you're not drinking a lot of sugar sweetened beverages that might have added high fructose corn syrup, because that's been associated with not being healthy for the liver either. But if you're avoiding drinking a lot of sugar sweetened beverages or other fast food products, then I think in that moderate keto diet, which is about that 40% carbohydrate, that should be okay.
I might just, that was, I really enjoyed that. Often people come to me and when they're talking about the keto diet, I often, the way I put it, which is not nearly as technical because I'm not a dietitian, obviously, I mean, there have been many diets throughout the years that looked at cutting back carbohydrates, whether it's the Zone or Atkins diet. These are all low carbohydrate diets. And I think they're all broadly healthier for the liver, because it's getting people to reduce their carbohydrates. And carbohydrates are things like, you know, potatoes and rice and pasta, and all the things that we really love to eat. And so people have a real trouble cutting those back. And so what these diets do is they focus on reducing those type of foods in our diets and focusing on other things that Dr. Maker was really talking about in the Mediterranean pyramid, focusing on those other foods. And what the keto diet does is, I mean, we all like fatty foods too. I mean, that's something that we kind of enjoy. And so what you're doing is you're going on to a low carbohydrate diet, but you're actually then taking in fats as a way. I mean, obviously there's metabolic consequence, but I mean, it's actually almost like a reward in some ways, because we do enjoy fats. And so it's just another iteration or another form of a low carbohydrate diet, which is really the goal, I think, for a healthy liver, is trying to cut back the carbohydrates in our diet to a level that is healthy. And I just want to come back to one other thing that Dr. Maker said, which I think is absolutely critical. And I see it over and over again in the clinic, especially people that have advanced scarring in the liver, is this intake of fructose containing beverages. And so, you know, people say, what the heck's a fructose containing beverage? Well, I just say pop. Pop is probably the biggest thing that I see in the clinic, where people, they might even have a relatively good diet, almost like a Mediterranean diet, but they drink, you know, a half liter of Coke a day. And so, and fructose is very, very damaging to the liver. And in fact, if you put mice on a high fructose diet, they get liver disease and they can get cirrhosis, and it actually will kill them eventually. So it's really important to make healthier choices. And I think those type of things, especially pop and sweetened drinks like iced tea and things like that, are very unhealthy for the liver, because the liver can't handle them.
And I might want to add just to the sugars, fructose in fruits and vegetables are good for you. Like, they have a much lower amount than those carbonated beverages like Coke or Sprite or whatever sugar sweetened beverage it is. So we don't mean the sugar that's naturally present in half that plate. We don't mean those, we mean the sugar sweetened beverages. So I think that's really important, because I do get asked often, so should I just eat a whole lot less of like fruit or like oranges or whatever? We don't mean those kind of foods. We mean the things in that fast food realm and in the sugar sweetened beverages, because definitely I agree, you could eat the rest is on your plate, but if you're drinking, you know, 2 cans of Coke a day, that's not great for your liver.
And I think this discussion is so important. Another thing is that whenever I think people start to talk about diet, I'm going to go on a diet, automatically that conjures up deprivation, and I think that is doomed to fail. It might not fail in a week, it might not fail in a month, but it's very hard to maintain anything that's called a diet in the long run. And some people can do it, but it's very challenging. So really it's to take what Dr. Mager said about that Mediterranean diet pyramid and try to focus on that. Cut back carbohydrates, cut back calories, and focus on those healthier food groups, and try to change a diet in a way that's sustainable. Because if it's not sustainable, then, and most people have tried to lose weight, they know that they fluctuate. The weight goes up, the weight goes down because they go on a diet, they lose the weight. And like Bernstein would be a classic example. People starve themselves, they can lose tons of weight, but it's not sustainable in the long run. And they gain it back and they often overshoot what they started at. So it's really important to focus on healthy choices, trying to cut back the calories, and try to make it something that you can live with and that's sustainable.
And you can reduce your calories just by following half the plate full of vegetables and fruits and vegetables. If they don't have a lot of sugar, like extra sauces on them, that alone is a lower calorie approach without being in a diet. So it really is a way of life, and making transitions towards that will be more sustainable than, as Dr. Swain said, all of a sudden take away all your favorite foods.
And I think what highlights that is if you look back, even a year ago or 2 years ago, I felt like everyone, all my friends, everyone was doing the keto diet, but now I don't hear about it so much. And because these diets are fads and they're not sustainable. I mean, who really wants to have whipped cream on their breakfast, you know, on 2 eggs or what? I mean, it starts to become something you just can't sustain because it's not. We're actually, I think broadly, we like to eat a broad-based diet that has lots of different choices, and so our tendency is to go back to that, and it's not sustainable.
I agree.
Well, the next question here is a few of them that are kind of aligned along the same topic for Dr. Swain. Generally outlining how long it takes to reverse fatty liver disease and how frequently should patients who were diagnosed be expected to do follow-ups with their doctors until their fatty liver disease is, quote, clear, and end quote.
Right. So that's a very good question. It's quite broad, because I think that the important thing is to identify people that have fat in their liver, because it's 25% of the population. So obviously most people with fat in the liver are going to be followed and should be followed by their primary care physicians, not by a specialist or anything like that. And really the people that need to come to see a liver specialist would be the people that actually are showing evidence of scarring in their liver. And then there are different ways to do that, but they're going to need to be identified in primary care. And the way it's really done now is through an ultrasound that shows fat, and people get worried and might send them, or abnormal liver tests. But I think we have to get better at identifying those people. The question about reversing the scarring, that's an extremely good question, because I don't think we really understand it. We know that people move back and forth with regards to scarring, and people used to think that when the liver got scarred, it never went away. But now there's something that we call remodeling, and that means if you take away the injury to the liver, so in this case it would be the bad fats that are accumulating in the liver, and then the immune response, or the immune cells that go in there and try to kill those liver cells. If you actually dampen that by doing the dietary changes that Dr. Mager said, and potentially maybe with medications in the future, then actually the liver can recover. I mean, the liver is trying to regenerate all the time, and so if you can remove that ongoing insult, then actually the liver can get better. And some people talk about 20% of people moving which way or the other way in over sort of a 2-year period, but I think it's unclear. What we do know though is that people have significant liver scarring, then they need to be followed more regularly. And there are ways that we can do that with putting an ultrasound pulse through the liver and things like that. It's called a FibroScan or shear wave elastography, and that kind of gives us an idea if the scarring is getting better over time. And so you can follow people that way, and also use blood tests to tell if it looks, because you can calculate, there's a way of estimating how much scar tissue is in the liver based on liver tests, and sometimes you can follow those too. But that's an area that's really developing, and I think in the next sort of 2 to 5 years, we're going to have way better tools on how to follow that. And so how often you should see your doctor really is going to depend on on if you have a liver problem, like a liver disease, which is scarring in the liver, or not. If you don't have scarring, then you should be following up with your doctor to treat the metabolic syndrome, which is, in its own right, places you at risk of dying of a heart attack or stroke, so it's important to try to deal with that. If you have scarring in the liver, you're going to see your doctor more often the more scarring that there's there. So if you have cirrhosis, then you're going to see your doctor more frequently than if you have sort of moderate scarring in the liver. But I think when you've declared yourself as one of these people that is going to get scarring in the liver, which is probably about a quarter of the people that have fatty liver disease at most, then those are the people that are going to need to be followed more closely from a liver perspective. I hope that answered your question.
This next question is for Dr. Major, and again, it's a few different kind of topics that not only from the CLF perspective that we get as well, but also with this webinar as well, and it has to do with intermittent fasting. So the questions I often hear about intermittent fasting and health benefits associated with it: is this accurate? Is it safe for someone with fatty liver disease to practice intermittent fasting, or is it considered more harmful?
So intermittent fasting it depends on how long the fasting period is. There are some of the protocols are that you should only eat an 8-hour period. And so the fasting is a 16-hour type of period. That's probably fine. Some people find that helpful so that they don't overeat in the evenings, for example, and that's perfectly okay in terms of doing. The idea being behind those fasts is that, again, though, that during the periods of time when you are eating, a lower carbohydrate approach would be better because it would keep down your insulin levels and reduce the fat synthesis in your liver. When you're fasting itself, your body slows down the amount of insulin it releases from the pancreas, and therefore fat synthesis will be a little bit affected in a favorable way too. So those kind of intermittent fasting approaches are probably fine. Again, the principle is to try to keep insulin levels down so that you're not making fat in your liver and in other parts of your body, and to try to reduce binging so that you're not eating lots in the evening. If you're talking about longer periods of intermittent fasting, say not eating anything for 24 hours, for example, and doing that every couple of days, that's probably not going to be beneficial. And it's also a lot harder for an individual to meet their fluid needs, their electrolyte needs, and their micronutrient needs doing that kind of approach. So if you're, as I said, if you're talking about intermittent fasting that's more than 12 hours but less than 24 hours, that's doing it once a week or so forth is fine. Intermittent fasting, some people do it every day where they just eat with those 8 hours. That's probably fine too, and probably has no harm so long as you're not binging all at one time and that you're eating a wide variety of diet. It may be beneficial. I think we need some more studies to show if that will help really affect in the long term fat deposition in the liver, but in the shorter term, it might be a little bit beneficial. I don't think the jury's still kind of out on that. There's not enough studies watching people do that for a long enough period of time to really know for sure.
And maybe I'll just comment too, because this is the latest phase. It was keto diet that was so prevalent before, but obviously intermittent fasting is becoming quite a thing. Again, it is a diet, and so everyone's going to have their own capacity to maintain that, but it's hard to maintain. And so often the ways to get a fasting in is that often we don't fast long enough because we actually eat before we go to bed. And so if you're eating before you go to bed and you're waking up relatively early and you're eating in the morning, then you're actually, the amount of time you're fasting, which is nighttime, is quite short. And so a simple way to do is to start fasting is to not have a snack in the evening. Make sure that you don't eat past supper time, and just start with simple things like that. Simpler things than that. And then if you do need to have a snack, try to keep it before 7 p.m. So at least you have this period of time where you are in essence fasting. People don't think of sleeping as fasting, but it is fasting.
I agree with that.
Next question here, Dr. Swain as well. we seem to get some certain inquiries, I don't know from the CLF side, but also some of the questions we're getting here, that there tends to be some different terminology with respect to fatty liver disease and quote unquote its stages. So we get people kind of refer to it as mild, moderate, or severe, and then some would call it as stage 1, 2, or even 3 fatty liver. So when you speak with your patients, what terminology do you use, or how best would you explain this to your patients?
So that's a very good question, because I think this is a lot of confusion, even with physicians. And so I think that the most important thing is there's different things going on in the liver, and those are things that are more important or less important. So often people will go for an ultrasound, and the ultrasound will say severe steatosis, which means severe fat in the liver. And so the patient or the family doctor or the person will see severe, and they'll go, oh my goodness, this is horrible. I have severe fatty liver, which means I have severe disease. That doesn't mean they don't go together. So the severity of the fat in the liver is not an indicator of the severity of the liver disease. It's an indicator of the severity of how altered or abnormal the metabolism in that person is. And so higher insulin levels, dietary issues, higher blood glucose levels, so insulin resistance. This is what's showing up as fatty liver. But the severity of that is not important. In fact, we've actually worked with our radiologists in Calgary to if they comment on that, to put right below, right on the reports to the physicians, is that the severity of the fat in the liver does not correlate with liver disease. So that's one thing. So that's very important, to not get panicked if someone tells you have severe steatosis. But I think it gives you a sort of a target in that, to try to improve your metabolism, I guess, through controlling sugars and whatnot. The other part is, it really comes down to when a liver specialist is talking about liver disease, what they're talking about is they're talking about the inflammation in the liver, which is the immune cells that are coming in to kill the liver cells that are full of fat. So that inflammation often will be graded, and often people use something called an NAS score. But really, the importance is that would be sort of, you can have mild, you can have moderate, you can severe inflammation. And people used to be very worried about that, and they felt that was the biggest issue in people with fatty liver disease. But we know now that's not the biggest issue. It's obviously an issue, but the biggest issue is how much scar tissue is in the liver. And when people are taught, when you see a liver specialist and they're talking about stage of your liver disease, they're actually talking about the scar tissue in the liver. And so this is really, you can do it by fiber scans indirectly and things like that, but really, how much inflammation in the liver and how much scarring in the liver is usually determined by a liver biopsy. That's still the way we do it. You can make estimates with the other ones, but a liver biopsy is usually what tells you that. And the scarring is put into 4 different, well, actually 5 stages. So 0, it means there's no scarring in the liver. So you can have fatty liver disease and you can have inflammation or damage in the liver, but no scarring. So that's a 0 out of 4. And then 1, 2, 3, 4 are the 4 stages that go along with scarring. And 4 out of 4 means cirrhosis. So if someone says you have stage 4 fatty liver disease, that to a liver specialist would mean that you have cirrhosis. Mm-hmm. Stage 3 means you have lots of scarring in the liver, but it's not at cirrhosis yet. Stage 2 would mean that you have moderate scarring. And we know that anyone that's stage 2 or above has increased risk of having progressive liver disease, so more scarring. And those are the people that typically a liver specialist would want to see more often, or a specialist, because we know they're the people at the highest risk of developing progressive liver disease to cirrhosis and potentially liver failure and liver cancer. People with stage 1 or 0 have, one is mild scarring, and those people right now we feel are quite low risk of progressing from a scarring point of view.
Well, if you guys are okay, we'll just have 2 final questions. We're just about a few minutes after each. So this second last question for Dr. Major, relatively specific with respect to diet. When eating fruit, smoothies, or foods with natural sugars, is there a benefit to eating a protein source like nuts or cheese to prevent sugar spikes and regulate insulin levels? And does this benefit those with fatty liver in any way?
I mean, that's a good question, a really good question. I think in theory it could be beneficial, especially if you have diabetes, because to go along with a fatty liver, because preventing spikes in blood sugars going up is what you want to do in overall therapies for if you have diabetes. I think if you don't have diabetes and your blood sugar is fine, then I think that there's no harm in doing that. In fact, it probably tastes really good. But I'm not sure that for sure we know that it would specifically help. It might over the long term, because it'll keep, again, your baseline insulin levels a little bit low. It depends on the size and how much fruit and cheese we're talking about. If we're talking about a whole plate full of fruit and cheese and that's your snack at night, then probably not. But if you're just talking about like a piece of fruit with a couple of small cubes of cheese to go with it, perfectly fun to eat. It tastes really yummy, and I think it would be good if you in terms of ameliorating the glucose spikes. And particularly if you have diabetes, I think that's a really good idea.
Just a final question here, I guess for both of you. There's a lot happening in the fatty liver disease space, and the conversation seems to have just begun. In your world, where do you want the NAFLD or even NASH discussion to be 1 year from now, or even 5 years from now?
Go ahead. Want to go ahead, Dr. Mager?
So you can go ahead first, Dr. Swain.
Yeah, sure. Okay. I think the biggest issue that lies ahead of us, I think there's a couple big issues, but I think a really big issue, I've tried to come to this a few times, is actually how do we, so 25% of all the adults have fatty liver disease. How do we find the people from all of those individuals that we need to worry about their liver compared to not worry about their liver? And so I think there's going to be a lot of discussion on how we can get better at a family doctor level of identifying who should maybe see a liver specialist and who doesn't ever need to see a liver specialist. And then how to follow those people over time to make sure that if someone looked like now they don't need to see a liver specialist, 10 years from now, if they do, then we have a way of capturing them before they get to advanced liver disease and cirrhosis. And then I think that the other part is we're in an era where there's a lot of interest in developing medications to treat fatty liver disease. And obviously lifestyle is the cornerstone, but recognizing the challenges with lifestyle modifications and following the proper diet, which a lot of us have an issue with. I think having a medication that is certainly that targeted scar tissue, I think is going to be a huge advance, especially for people that come to their doctor and the doctor says, you know what, you've got cirrhosis or you've got stage 3 scarring, so just before cirrhosis. And then that's a desperate feeling. And if there's no medications and people are saying, well, you just have to do a lifestyle, I think it's very hard to go from that panicky feeling to suddenly, I've got to change how I eat and that's going to make my liver better. I think it's hard to know how much that's going to really influence that scar tissue. So it would be very nice, and I think this is coming in the not so distant future, probably 2 to 5 years in Canada, but we'll have drugs that target that scar tissue so to help people keep their liver healthy while they're trying to do the modifications in their lifestyle, which is really going to keep their liver healthy for the long term.
So for me, the answer to that, I'm a pediatric dietitian and my research is a lot in kids with NAFLD. So I would love to see more public education in the schools about liver health in general. I also would love to see parental and school involvement in that education, because in order to make lifestyle change, it needs to be a family-based approach. It's not one person in the family who has a fatty liver who should be changing their diet. It's a way of life. And really, the families have told us in research studies that it's hard to walk the walk, to change your lifestyle when your child has fatty liver, and they need to change when you're an adult. So the place to do that is to do it at the family level and to do it with the kids, so including the parents. So I'd love to see more public education in the school system with engaging the parents in healthy eating with their child in the schools. Guys, I think we're going to have more longer term as a population success. And there's some avenues and some pockets that that happens, but I don't think it universally happens. And also, I think Dr. Swain's point about for the primary care physicians who see these patients for not only identification, but they need support and resources in order to be able to see the patients. I mean, after all, 25% of overweight or obese adults probably have a fatty liver and at some level need access to primary care professionals. And that includes physicians, but it includes dietitians too. So that would be where I would love to see happen.
In fact, I might just come back to that very quick, because I think that's a fantastic point, is that this is a multidisciplinary, multi-generational thing that I think we typically approach things, well, a family doctor does this and then it gets referred to here, and then you might get an involvement of a dietitian. I think we have to view this as something that we need a team approach, whether it's someone to help with exercise, someone to help with a proper diet, someone to help with psychosocial issues that might be driving certain patterns of eating that is very hard to get out of, and then some people to look at cardiovascular health, so heart attacks and things like that, and someone to look at diabetes control, and someone to look at liver health, and trying to get all of those people working together in a holistic approach to keeping people healthy, I think is really where we have to move ultimately, especially with something like fatty liver disease.
Thank you, guys. With that final answer, that concludes our live talk for this evening. And we had a few questions that we couldn't answer, but by all means, visit us on our webpage, reach us on our toll-free line or email service to social media, and we'll be glad to answer some of the questions were left unanswered this evening. I'd like to take this time to thank both of our speakers, Dr. Swain, Dr. Major, for the great presentations. I also want to give a huge thank you to all the participants and listeners and our entire CLF community for tuning in tonight. As mentioned at the beginning, this presentation will be available on our Facebook page. Will also be available on our liver.ca website and our YouTube page over the next few days as well. And of course, to learn more about fatty liver disease and all other liver diseases, or to find out about the Canadian Liver Foundation and our mission to bring liver research to life, please visit us again at www.liver.ca, and be sure to follow us on social media, Facebook, Twitter, Instagram, for all the most up-to-date information and liver health tips. So thank you again, everyone, and have a great evening.
Thank you.